Hi, my name is Dr. Faramaris Hidaji. For the past 20 years, my specialty has been correcting crossed eyes or lazy eyes. Strabismus, or a crossed eye as it's called, is a very common condition. Unfortunately, many people think they have to live with it, and that's just not true. What I do for a living is make people look better by straightening their eyes. And I made this video because I get patients in my office frequently who think that nothing can be done, or they were maybe told by a doctor that nothing can be done, and that's just not true. If you've lived with a crossed eye or lazy eye most of your life and are thinking about doing something about it, this video is for you. I decided to make this video because very commonly patients come to me with misconceptions about this procedure, and I'd like to clear up those misconceptions. Sometimes eye doctors that don't do this procedure themselves may tell their patients that nothing can be done, and there's nothing farther from the truth. A lazy eye or crossed eye can be corrected rather easily through a simple surgery that's done on an outpatient basis. We'll talk more about the details of the procedure itself in the second segment of this video. When a patient comes in to learn more about strabismus surgery, they often have 4 questions. A common thing I hear from my patients is that the procedure is cosmetic. They bring this term up because sometimes they think it's being vain to want to correct a crossed eye or lazy eye, and often they also think that insurance won't cover it because it's a cosmetic surgery. Both of those are misconceptions. First, I don't consider it to be cosmetic to correct a misaligned eye. The eyes are the first thing that people notice about you, and often when one of your eyes is not straight, it makes an impression that people can't get past. Correcting that crossed eye simply allows people to notice the rest of you. In most cases, yes. Oftentimes, a crossed eye or lazy eye causes symptoms like double vision, eye strain, difficulty driving, or a reduced visual field. All those complaints are considered legitimate by an insurance company, and they will allow the insurance company to cover the cost of the procedure. The second most common question I hear is, does the procedure hurt? I usually do this procedure under what's called general anesthesia. That means that you'll be put under anesthesia and you'll be asleep during the procedure, so you will feel no pain during the procedure itself. I usually use a numbing injection at the end of the surgery, so you won't feel any pain afterwards either. Some of my patients describe a gritty sensation as if there's a hair in their eye for a few hours after the surgery is done. There's very little postoperative care involved after a surgery like this. You will have to take a few days off from work and about 2 weeks off from strenuous activity like weightlifting or jogging. After the surgery, you'll be using an eye drop 4 times a day for about a week. Other postoperative care instructions are to keep the eye clean and dry. I ask my patients not to go swimming for 1 week. I ask them not to bend over to pick something heavier than 5 or 10 pounds for about 1 week's time. Patients also ask me what their eye will look like after the surgery. What I tell them is that the incision is done underneath the eyelid, so there's no visible scar once the eye is healed. There might be a little bit of bright red blood on the white part of the eye right after the surgery, which resolves in about 5 to 7 days. Though most of my patients have very little pain afterwards and can resume normal activity in a day or 2, this is an eye surgery, and so there are risks involved, and you need to be fully aware of those risks before you decide to proceed. The risk that my patients sometimes worry most about is, can this affect their vision, or even worse, can it make them go blind? I can tell you that in almost 20 years of surgery, I've not had a single patient that's had that complication. It is reported to happen, but it's an exceedingly rare complication. There are some more common complications that you should know about. You will have a little bit of bleeding after the procedure. It usually amounts to about 1/4 of a teaspoon of blood, but coming from the eye, of course, it looks like a lot. That bleeding should resolve very quickly. Any surgery can result in infection. However, after this surgery, that's an exceedingly rare complication. It happens in less than 1 in 1,000 patients. None of my patients in over 5,000 procedures have ever had that complication. Another important fact for you to understand is that the surgery isn't always successful. My success rate ranges between 80 and 90%. What that means is, in 4 out of 5 patients, the eyes become straight after surgery to the point where people looking at you won't be able to tell that you have any misalignment at all. That does mean that you have about a 1 in 5 chance of still being a little bit turned inward or even a little turned outward after surgery. Now, if it's not noticeable and you're content with the results of your surgery, we can leave it exactly like that. If, however, it still is noticeable, we have the option of doing a second procedure. In part 2 of this video series, I'll be talking about the particulars of the procedure itself. And in part 3, we'll be talking in more detail about the postoperative care and requirements after the surgery. My intention by creating this video was to give you all the facts you needed to make a good decision about whether or not to have correction for your crossed eye or lazy eye.